There is mass effect on the central biliary duct.
I'm a marketing and corporate communications manager for an insurance company. Okay, it was in 2017. I think I went to do a check and I said, oh, my stomach is big, I bet I have fibroids. Like, I was just joking about it. And he said, I don't think so. But he said, okay, go and do a test. So I went somewhere, he sent me to a diagnostic clinic and I did an ultrasound and I figured that I had fibroids then. But I didn't think anything of it at the time because they just said I had fibroids and said that some were big but it's not so big and some were small. So I just, it's 2017. Well, for me, my issue with it was that when I had my periods, I had 2 days when I bled a lot, so it was quite heavy. And I was always anemic, so that's the reason I went to the hospital, because I was always anemic. My blood count when I last did it prior to coming here was 8. And yeah, for me it was the anemia. I used to have cramps, but for me it was the anemia, the cramps and the heavy period and elongated period as well. So instead of like a 6-day, I would be going on for like 10 to 14 days of just constantly bleeding, which wasn't healthy for me at all. So when I found out in 2017 that I had fibroids, as I said, I wasn't aware of the size. So they stated something, I just put the file away. I think in 2018, I checked again. I actually thought about going back to London to go and do an operation, but I didn't want to do surgery either. So it was just something I was thinking about for a year and a half. Well, the truth is, in Nigeria here, everybody talks about surgery. Then there's all these people selling these herbal medication, but I don't really believe in that, because after people have done the herbal medication, they still come back to surgery, and I didn't really want to do surgery here. I thought about it, as I said, going to London to do surgery, but for me, surgery was an option. So I think I just sat there and I said, oh God, just provide a solution. So I just started Googling, and as I Googled, I saw UFE. I'm like, what's that? So I just started reading up about it, just looking at cases and stuff, and I just thought, okay. I remember I made some calls around to certain hospitals here and they said they didn't do it. How I knew about Uterine, there was a lady I met where I do my nails. So someone said she had a fibroid operation. So I spoke to her, got his number. I spoke to him on the phone, very friendly guy. We did a face-to-face meeting via the mobile app, and then connected to Uterine, his assistant. I went through the process, I did an MRI, and then on the set day I came here, just the normal, came in early, went through the information, gave me information about the operation and how long it will take and what they'll be doing. And the procedure, I think it was like about an hour and a half, not longer than that. And then I settled into the room here and I left the next morning. So it was straightforward. He explained everything to me as I got here and it was quite friendly. And he followed up as well. Yeah, because science there's a lot happening in the technology first. So basically, when I went online and I saw other people and their testimonies, I believe that, yeah, if they can do it and if it's possible. And I spoke to the lady that introduced me, because she already came a month before I met her. And yeah, I did. So when I came and I spoke to him, I was confident about it. And I'm that kind of person, I would never do surgery in Nigeria, not anything. It's just that the results are not always that great. But for some reason, I was calm about it. And when I heard about it, I think I spoke to a lady about 2.5 months before my operation. And I was calm about it. I just prayed about it and said, God, show me any signs. Nothing happened. I came in here calm and I left calm and it was fine. Okay, so when I first came, they tell you how long it will take, like take a week, 10 days off work. Because of my schedule at work, the first week really didn't do much. I could talk to people on the phone, but I wasn't, when I left here, I was jumping around. But I think by night time it hit me, the pain. I have these cramps, so the first 3 days was tough, but not so bad. I have a high pain threshold. I went back to work the following week on Monday, but I wasn't feeling too strong. So I just took the rest of the week off. So I stayed at home for like 2 weeks. By the second week, I stopped feeling the cramps. And by the third week, actually, I took the painkillers like as prescribed for the first 3 days, because there's quite a bit of them. By the end of that week, I stopped taking it. I just took it as and when. And by the second week, I was just taking it as when I felt the pain. So it was all right. For me, it was like, stayed on for 2 weeks and it was fine. By the third week, I didn't feel any pain. I didn't realize I had anything done. So it was fine. It was fantastic, actually. I've actually told quite a few people about it, actually. So now I've seen my results, I'll tell them. So yeah, I would. I think for most people that have fibroids and don't want to go through the surgery option, this is one of the best options I see out there. It's non-invasive, so you don't get cut up, and the healing period is lesser than when you do normal surgery. So yeah, I'd recommend that anybody going through the same symptoms, especially if you're having heavy periods as disrupting your life, you should come and try it. As I said, I'm a living testament. So I have to say it's a blessing and thank you, Lord. So yeah, I'm happy.
My name is Dr. Hamed Nino Lowo. I'm a vascular and interventional radiologist, and one of the procedures that I offer is a procedure called uterine fibroid embolization, which is a minimally invasive method to treat fibroids without having to go through surgery. I met Miss CE earlier this year during video consultation while I was in America, and at that time she was seeking treatment options for uterine fibroids. She was actually referred to me by another one of my patients who I had treated a month earlier. She was very energetic when she talked to me via video, and was quite apprehensive about doing any type of surgical procedures in Nigeria. But again, I've practiced in America, and I also practice currently in Lagos doing the same thing, and she developed a lot of confidence in the process and signed up to have a procedure done. She came in for a procedure just like any one of our patients. A procedure lasted about an hour. We were done with the procedure, and she was able to go home the next day. She showed up for follow-up appointments and gave us very positive feedback on our progress. She significantly decreased in the rate of her bleeding, and also decreased the rate of her pain after the procedure, and again remained very energetic. This is a procedure we've now offered in Lagos for over a year now. Now women have the option of either going to surgery or having a minimally invasive procedure to treat their fibroids. The advantages again of uterine fibroid embolization is being able to go home by the next day and get up back on your feet in a very short period of time with very small amount of downtime, and being able to go back to work in your regular life without having fibroid symptoms anymore.